Assalamualaikum and hello everyone. I am LIYANA along with HANIS, HIDAYAH, IRDINA, LIYANA and MOHAMAD ANIQ from Group 13 will be presenting about alternative pain management. In this presentation, we will be talking about the introduction to alternative therapy, case report presentation, and other alternative therapies available. What is alternative therapy? It is any medical treatment or intervention that is used in place of conventional medicine. Next is a case report entitled Myasthenia gravis therapy with individualized homeopathy. This is the case of a 61-year-old man who presented to the neurology department in April 2018 for severe myasthenia gravis, which is an autoimmune pathology of neuromuscular transmission characterized by variable degrees of weakness in skeletal muscles. He was non-responsive to conventional therapy, hence he was treated with individualized homeopathy complementary to conventional therapy, and he demonstrated a significant improvement on his clinical status and no disease symptom. In combination with conventional medication, the patient was treated with a series of individualized homeopathic remedies chosen according to his symptoms presented at each follow-up visit. At this presented case, one dose of homeopathic treatment consists of 7 granules of a remedy administered sublingually. This slide summarized the homeopathic prescription in the case based on signs and symptoms. First is Aconitum napellus and Causticum. Both are used to treat palpebral ptosis, dysphagia, and diplopia. For Mercurius corrosivus, it is used for acute urinary infection and prostatitis with pronounced symptoms and fever. And Arsenicum album is used for the treatment of allergy and hemorrhoid. Moving on to homeopathy. It is a symptom of therapeutics founded on the stated principle, like cures like, which prescribed for patients drugs that would produce in healthy persons symptoms of the diseases being treated. Homeopathic remedies are made from natural sources, for example plants and minerals, and it is usually taken as a tablet, but are also available as liquids, powder or creams. It is gentle and rarely causes side effects, which makes it suitable for adults, children, pregnant or breastfeeding women. The picture on the right shows Samuel Hahnemann, the founder of homeopathy. Next is preparation of homeopathic medicines. It consists of repeated dilution and shaking, called potentiation, to render the remedies capable of stimulating the body's natural healing processes. After the 12th dilution, there is no discernible chemical trace of the original substance left in the medicines, but homeopaths believe the preparation retains the qualities of the original substance. More diluted solution is considered to have a higher potency. The potency choice is according to the health level. For example, a lower health level or a state of imminent danger implies a low potency, such as the TC. Homeopathic remedies is indicated in a wide range of health conditions such as myasthenia gravis, asthma, ear infection, hay fever and allergies, and it is used as complementary to conventional therapy. And these are the homeopathy applications in dentistry. These recommended remedial measures are not intended to replace good dental care, but rather to function as a safe, effective, and conservative form of emergency and post-operative treatment. First, we have arnica, which is used in inflammation and trauma from routine dental procedures. Included in this category are post-operative swelling from injections, extraction of teeth, gum surgery, preparation of teeth, and soreness following insertions of a new full or partial dentures. 3 to 5 pellets is used every 20 minutes until symptoms subside. Next is hypericum. It is well suited for the nerve pain associated with tooth eruption, which is teething. 5 pellets is used every half an hour until symptoms subside. The third one is belladonna, used for the treatment of toothache accompanied by throbbing pain and is worse from motion, touch or chewing. 3 pellets is used every half an hour to 1 hour until symptoms subside. Lastly is cuprum metallicum. It is ideal once the muscle spasms start, and 3 pellets is used every 20 minutes until abated. Other alternative therapies will be discussed in the next slides.
The first alternative therapy is traditional Malay medicine treatment, and these are all 14 modalities that are available currently in Malaysia. The first traditional treatment is traditional Malay massage, also known as urut Melayu, and the principle of this treatment is angin, wind, and urat veins, which means this treatment include the nervous system or blood and the lymphatic vessels. So vein will be needed using long strokes to expel the wind, and oil will be used to facilitate the movement of massage and for its predicated medicinal properties. After influence of Islam, the quotations from Al-Quran and Hadith have been used to replace the mantras used while massaging. So the effects include increasing blood flow, relieving pain and muscle spasm, rehabilitation of the whole body or part of the body. And the types available are postnatal massage, urut patah or bone setter, therapeutic massage, and also reproductive vitality enhancement massage. So the second one is bekam or cupping therapy. It involves the use of cups containing low pressure air or vacuum and placed on the skin at certain parts of the body. So the vacuum can be generated either using the heating method or mechanical suctions. So the underlying skin will be sucked slowly into the cupping cup, and it will help to improve the blood circulation and stimulate recovery. However, each procedure should not extract more than 10 ml per kg of blood. And there are two forms of cupping, which are dry cupping and also wet cupping. Dry cupping will have no incisions or cuts, and it will be carried until the skin side begins to appear reddish. While the wet cupping, there will be a small superficial skin incision, and the skin and blood will be both sucked slowly into the cup. And side effects include slightly dizziness, and after treatment there will be skin irritation and march in a circular pattern. The third one is confinement or pantang. In Malay culture, 44 days of postpartum period is strongly connected to cultural beliefs and traditional practices. It includes food restrictions and certain practices. So there are three major features in Malay postnatal care. The first one is the use of herbs. Different types of herbs will be used during the confinement period. It can be taken orally in the form of decoction, capsule, or grounded and cooked with honey. It also known as majun. Or it can be used externally as a herbal bath, or can be mixed into the massage oil and used as herbal paste. And the second one is the use of heat. Heat is used in the form of direct exposure, such as bertungku or warm herbal bath. And indirect heat exposure can be achieved by consuming heaty food during the confinement period. So lastly, the Malay postnatal massage, it includes the whole body massage and also hot compression or bertungku and body wrapping, barut. Body massage is done at least 6 to 7 times during the confinement period. And lastly is the usage of Malay herbs. There are many herbs used in the Malay traditional treatment. However, the most famous one is Kacip Fatimah, or its scientific name is Labizia pumila, and its family is Primulaceae, native to Malaysia. It is a small woody and leafy plant with leaves of 20 cm in length and grows widely in the shade of the tropical forest floor. It can be seen such as in the picture. And its traditional uses is it used by the new mothers to regain back their strength, and it used to delay fertility, to induce labor, as a treatment for flatulence or to pass the gas from the digestive system, and it also helped to treat dysentery and dysmenorrhea. Its biological and pharmacological activities include antioxidant, antimicrobial, cytotoxic, and also estrogenic activity.
Now I will continue with traditional Indian medicine. So traditional Indian medicine is based on herbal medicines from nature, which consists of mind, body, and spirit. Okay, next. How do we apply it in a dental treatment? First, chewing sticks. For the chewing sticks, it is a herb sticks which is known as kashaya, katu, or tikta in taste. Tikta is bitter. The most commonly used is from a neem mango and Indian gooseberry. The stick is from a neem mango and an Indian gooseberry. And it is also the same as miswak, which is popular among Muslims. There is a study shows that Streptococcus mutans were more susceptible to miswak than lactobacilli. Ayurveda recommend chewing sticks in the morning as well as after every meal to prevent disease. The second one is tongue cleaning, which is called as Jihwa Pakshalana. In Ayurveda traditional medicine, tongues play a huge role in making diagnosis of disease. So scraping is recommended to remove toxic debris, which is called ama, undigested. In oral hygiene, ama or coating on tongue in the morning it is due to incomplete digestion. The amount of ama indicates the health of digestive system. Scraping is done by a scraper made of copper, silver, gold, tin or brass, and should be done on the entire surface of tongue on empty stomach in the morning. So it's before eating. It is believed to ease digestion and boost immunity. The last one is oil pulling. It is involved swishing oil, which is a sunflower oil or sesame oil, in the mouth of oral for oral and systemic health benefit. Oil pulling is to prevent decay, bleeding gums, dryness of throat, and also cracked lips. It is used in cases where brushing cannot be done. An example is for the patient that is easily vomit. There are two primary oral cleansing technique, which is called Gandusha and Kavala. So for the Gandusha, you need to fill your mouth with the oil full until you cannot gargle for 3 minutes and then release. However, for the Kavala, you need to insert a comfortable amount of fluid, then let it for about 3 minutes and then gargle and then release. Next, I'll go to the next slide, is a complication and side effects. So the complication is it might cause the immune system to be more active, and this could increase the symptoms of autoimmune disease like SLE, systemic lupus erythematosus. Next, it could worsen the lung condition and may lead to asthma, which can affect the throat and the rest of the mouth. Next, liver problems, which may result in cheilitis, smooth tongue, bruxism, and crusted perioral rash. And finally, it may lead to xerostomia due to anxiety that caused by the hypoglycemia.
Traditional Chinese medicine is a standardized version of the type of Chinese medicine that was practiced before the Chinese Revolution that is based on several ancient beliefs, which is, first, Taoist, which believe that human body is a miniature version of the universe, and second is vital energy or qi, which flow through the body and perform multiple functions to maintain health. Traditional Chinese medicine consists of 3 parts, which is, first, theory that include yin-yang and 5 elements. Second, treatment, including herbalism, acupuncture, moxibustion, cupping, and massage therapy. And third is prevention that include qigong, tai chi, meditation, and massage. There is 6 modern therapeutic methods used in traditional Chinese medicine, which is acupuncture, moxibustion, tuna massage, cupping or scraping, Chinese herbs, and also traditional Chinese medicine nutrition. Acupuncture is the practice of inserting needles into the superficial skin, subcutaneous tissue, and muscle at particular acupuncture points and manipulating them. In traditional Chinese medicine, there are as many as 2,000 acupuncture points on the human body that are connected by 12 main meridians. And these meridians conduct energy or qi between the surface of the body and its internal organ. Then, acupuncture is also believed to keep the balance between yin and yang, thus allowing for the normal flow of the qi throughout the body and restoring health to the mind and the body. There is a promising scientific evidence to support the use of acupuncture for chronic pain conditions such as arthritis, headaches, and limited support for neck pain. Acupuncture also tends to provide a short-term clinically relevant effect when compared with a control or when acupuncture is added to another interventions in the treatment of chronic low back pain. Acupuncture is generally safe when administered using clean needles, either disposable or sterilized. The contraindications for acupuncture are pregnancy-limited points and cardiac pacemaker, while the precautions include epilepsy cautiously managed, drunk, exhausted, weak, or fasting person. Then the risk and complication for acupuncture include non-steroid needle, improper techniques, vasovagal reactions, and misdiagnosis. Multibustation is a therapy that involves burning moxa made from dry Artemisia vulgaris to facilitate healing. It's used to warm and evacuate the blood, stimulate the flow of qi, strengthen the kidney, expel wind and disperse cold, and dissolve stagnation. Historically, this therapy has been used to treat menstrual pain, and the complications include allergy reactions, burns, and infections. Qi massage is a combination of massage, acupressure, and other forms of body manipulations that can be quite vigorous at times. The practitioner may use herbal compress, ointments, and heats to enhance this technique. Qi is best suited for treating chronic pain and musculoskeletal conditions. It brings awareness back to the present body, making it the first step in healing process. It stimulates the flow of qi, blood, and body fluids. It can be used to treat pain, stress, and digestion problems. Cupping or scraping. Cupping is a type of Chinese massage consisting of placing several glass or plastic cups on the body. The suction of the cups mobilizes the blood flow to promote the healing of a broad range of medical ailments. Scraping or gua sha is a form of medicine technique that uses pieces of jade, bone, animal tusk, horn, or smooth stones to scrape along the skin to release obstruction and toxins that are trapped at the surface of the skin. It may contaminate it with drugs, toxins, or heavy metals. It do interact with drugs. Chinese herbs use leaves, roots, stems, flowers, and seeds of plants such as cinnamon bark, ginger, ginseng, licorice, and rhubarb. The herbs are combined into a formula that distinguishes parents in the form of traditional tea, capsule, liquor extract, granule, or powder. The effectiveness of Chinese herbology is still remain fully documented. Chinese nutrition. Chinese nutrition is a mode of dieting rooted in Chinese understanding of the effect of the foods on human organism. In traditional Chinese medicine, the nutrition is considered the first-line defense in health matter.
Next, we have chiropractic. So chiropractic is a practice of drug-free hands-on approach on healthcare. It is a system of complementary medicine based on the diagnosis and manipulative treatment of misalignment of the joints. Chiropractic focuses on disorders of the musculoskeletal system, nervous system, and the effects of these disorders on general health. The main objective of a doctor of chiropractic is to locate and correct the vertebral subluxation complex, which I will later explain. They address a variety of complaints from aches and pains to ear infections and high blood pressure. However, their concern is to find, remove, and prevent the subluxation. So subluxation is when the areas of the spine lose their normal position or motion. And as can be seen in the images below, the left side of the image is showing a straight normal spine, whereas the right image is portraying the misaligned spine. And this misalignment will cause interference with the nerve messages from the brain to the body and from the body to the brain. In other words, it can also be called as bone pinching a nerve, where it will set off a variety of simultaneous changes within our body and cause abnormal functions such as numbness or tingling sensation, joint pain, or reduced range of motion. A chiropractor can restore the misaligned vertebrae to their proper position in the spinal column manually using hands or with the aid of instruments. And chiropractic treatment has been able to treat patients suffering from back and neck pain, shoulder pain, consistent strains, headaches and migraine, and pain occurring after an accident.
I will continue with the last alternative therapy, that is osteopathy. Osteopathy is a way of detecting, treating, and preventing health problems by moving, stretching, and massaging a person's muscles and joints. It is based on the principle that the well-being of an individual depends on their bones, muscles, ligaments, and connective tissue functioning smoothly together. Osteopaths use physical manipulation, stretching, and massage with the aim of increasing the mobility of joints, relieving muscle tension, enhancing the blood supply to the tissues, and also helping the body to heal. According to the osteopathic philosophy, when the body's musculoskeletal system is not properly aligned, it inhibits circulatory, lymphatic, or nervous system function and therefore reduces the body's ability to heal itself. Any joint or muscle injury must be treated as part of the whole body, since other parts of the musculoskeletal system will also be affected. For example, an ankle injury may mean that the patient limps and favors the other foot. Over time, this imbalance can lead to other injuries such as soreness in the other ankle, knee or hip, or perhaps back pain. Osteopathy helps when one is having lower back pain, uncomplicated neck pain, shoulder or elbow pain, arthritis, sports injuries, muscle and joint pain associated with driving, work, or pregnancy, or problems with the pelvis, hips, and legs. An osteopath focuses on your whole body, including the soft tissues such as muscles, ligaments, and tendons, the spine and nervous system, and may use a variety of different hands-on methods, including spinal manipulation, soft tissue massage techniques, articulation, which is a gentle rhythmic joint movement, stretching muscles and joint capsules, muscle energy techniques, which encourage the muscles to work against resistance, and lastly, visceral manipulation, which is a gentle movement of the abdominal and pelvic areas. As osteopathic techniques include a gentle approach, they can be suitable for many people, from the newborn to the older person, and for those with complex medical problems. These are our references, and that's all from us. Thank you.